Hello everyone, I'm Dr. Jim Daly. I'm coming to you again this month with some more good information on how to manage your health and nutrition. We have a special topic for tonight, managing leg cramps. And this is something that I've really gotten quite a few questions and people with concerns about. It's not a life-threatening condition. It's not something that you have to be terribly worried about, but it's painful and it hurts, and it's really not an enjoyable thing. I think all of us have suffered from leg cramps, night cramps, or maybe after jogging or exercising, getting cramps in our legs. It's a pretty common phenomenon, and it's not real well understood by scientists and physiologists. So we'll talk a little bit about what we do know and what we might be able to do to mitigate some of that. What are leg cramps? They're often called Charlie horses. It's kind of an unexpected, pretty intense pain in the muscles, usually in your legs, but always large muscles and muscles that are close to a joint. Leg cramps usually last less than a minute, but they can last several minutes. But usually they'll go away pretty shortly, but while they're lasting, they're really intensely painful and can wake you up at night and impair your sleep. So what do you do, first of all, if you have a leg cramp? Obviously, you can't take your supplements to help a leg cramp, which you've already got. They don't work that fast. Even analgesics don't take care of that kind of pain that quick. It would go away before that kicked in. So as it turns out, what you have to do is just something you can do immediately yourself right then. Since this is a muscle that is contracted and tightened up, you want to reverse that process. So first of all, what you want to do is just kind of stretch your leg out. Get that muscle kind of pulled apart because it's pulled back together. I'll describe a little bit about how muscle works. I don't have it on the slide here, but you have two types of muscle fibers, actin and myosin, that kind of fit together, kind of like that. And when your muscle expands, it comes out, then it contracts, it goes back. It takes energies to actually pull that back out. And so when you get your muscle in there, it sometimes wants to stay, and that's a contraction that can be painful, very much so. Like I say, normally this will subside in a few minutes, but it can be rather intense. So we want to take action to also make sure we don't do much of it. But what you really have to do when you have it is stretch that muscle out and just kind of massage the area where it is. That kind of loosens that muscle up, makes it easier for it to pull back apart. And that's about all you can do in the immediate situation. So just, and that's kind of a natural reaction. We usually just naturally do what we're supposed to do. But just make sure you do that and it'll go away. But we want to make sure we don't get them again if we can. And sometimes people get them fairly frequently. And why one person does and another person does not is not completely known. But we do know some of the things that that do cause muscle cramps, apparently. Although they're quite unpredictable. Like we said, they usually occur in these large muscles, often after intense exercise, but paradoxically, sometimes when we're sleeping, just the opposite. But if you think about it, they're occurring when you've relaxed after exercising, so maybe that's not quite as paradoxical in both cases. Well, many things can trigger a muscle cramp. This includes poor circulation in your legs, can lead up to that. So I think a lot of people, especially if you're diabetic, have that problem. Working your calf muscles too hard while exercising can lead to that, especially when you stop. Not stretching enough appears to be something that's a problem. Doing stretching exercises tends to reduce that. It doesn't stop it necessarily, because I know people who do a lot of stretching exercises and yoga and stuff like that, and they still get cramps sometimes. So it doesn't, completely stop it, but the stretching exercises do seem to help. Um, Being active in hot temperatures sometimes seems to be linked to that. Muscle fatigue, which would make sense if there's not enough energy, ATP there to pull those fibers back apart, then they tend to contract. Dehydration, and that's a big one. Dehydration of the muscles can really interfere with how they contract and expand. The muscles have a fluid environment inside of it, and the muscle action is caused by release of calcium into that inner fluid inside the muscle cell, and it causes an electrical potential that pulls the muscle apart. And then it'll go back together as that pumped back, the calcium is pumped back into what they call the sarcoplasmic reticulum, which is where the calcium is stored when it's not being released. So it goes back and forth from the inside of the cell back into that little vacuole that holds it. And that's the way muscles work. So dehydration really affects that whole dynamic inside the cell. Magnesium or potassium deficiency seem to be linked to muscle cramping. Potassium deficiency has pretty decent research, actually. Not quite as strong for magnesium and calcium and their relationship to muscle cramps, although a lot of people, including doctors, feel like they are related, but the research hasn't been that positive on it, so we don't know for sure. Actually, muscle cramps are difficult to study, and so I think there's probably a lot we don't know because they happen so infrequently, spontaneously, without warning. You can't really predict, so it's hard to study. With me, I get muscle cramps at night sometimes. Sometimes I'll get it once or twice in a week, and then I'll go for months without a muscle cramp. So how do you study it? I can take supplements, and just because I haven't had any more for 2 or 3 months doesn't mean that it's working. It just means I haven't had it for 2 or 3 months. That's not unusual for me. So, setting up a study to really evaluate these things has been challenging for researchers. Calcium and sodium imbalance also. You can actually have too little sodium, believe it or not. Everybody's always concerned about getting too much, but you can actually have too little also. A problem such as spinal cord injury or pinched nerve certainly can lead to that, and kidney disease because of disturbances in these electrolytes can actually lead to muscle cramps as well. So there's a lot of things that are involved there that are sort of linked to it, but not necessarily the cause or direct causes, and there may be multiple things that cause muscle cramps. Some drugs lead up to muscle cramps, and boy, you can see a list here of drugs. Diuretics, it's pretty obvious that could be a problem because they lower the amount of fluid in your body. They're taken usually to lower blood pressure to get the fluid volume down, but it'll affect the muscle cells too and the fluid there. So, but you can go down, just sort of read through that list for a minute. One that I've heard a lot about lately is proton pump inhibitors that people take for preventing ulcers in the stomach, hyperacidity. That's a very common one. There again, but all of these are pretty common drugs that can lead to muscle cramps. So you want to be aware of that and be aware that if you're using these drugs, that you need to take extra precautions to kind of try and avoid the muscle cramps and do some of the nutritional things. Now, water is one of the biggest things that you can do, getting plenty of liquids for preventing cramps. And this is a really common problem. I had this slide in a previous talk about water, and 192 Florida agricultural workers were tested and found that 53% were dehydrated when they came to work, you know. And at the end of the workday, 81% were dehydrated. So, you know, almost everybody, it seemed like in those, among the agricultural workers down there, were dehydrated. And they were at really high risk of getting leg cramps. And at least once a week, 31% tested positive on a test for acute kidney injury that was caused by it. So you know that they're going to have a lot of problems if they are that dehydrated. You can check for your dehydration fairly easily, actually, if you want to go to a little bit of trouble. Actually, you can get inexpensive little instruments to measure the specific gravity of urine, but the 100 milliliters of urine should weigh less than 102 grams, essentially. The specific gravity should be less than 1.02. And you can get these little gravitometers as you stick down in a little thing of water that float in there, water or urine in this case, and will tell you where it is. And you can sort of estimate from that real quickly how hydrated you are and whether it's in a normal range. And you just want to kind of look at that picture there, and you can see the little curved, what we call meniscus, and where it's really at the very bottom of that is where you measure it. In this case, the urine reads almost perfect, the same as water, right there on the 20 for 20 mils, and so it's weighing 20 mils, so you can calculate from that at 1.02 where it should weigh when you put that on a scale and weigh the weight of the water. So you just have to measure it and see and weigh it. Another indicator is dark urine. That suggests dehydration as well, but it's not always reliable. Dark urine can have another cause. Sometimes, for instance, if you're taking a dietary supplement that has something in it, like riboflavin that turns urine yellow, then that wouldn't be an indicator. But otherwise, it should be almost clear or very slightly yellow, the urine should be, and that would indicate that you're in a good range for specific gravity. And speaking of water, we have these water bottles that really help you get your water all the time. It gives you measured amounts. We recommend that you have 4 ounces of water every 30 minutes until you've gotten half of your water body weight in ounces. So that's kind of the recommendation, but these are graduated in 4-ounce increments, so you can just go down through there during the day and get just the right amount of water. And we have these available if you would like them. It really helps out. Now, potassium, of all the minerals, potassium is the one mineral that has the best research for preventing the leg cramps. And it's also a mineral that you really do need a lot of. Most people don't realize it, but you need a lot more magnesium than any of the other minerals you may take as supplements. You need about 4,700 milligrams per day of potassium. That's a lot. Now, fortunately, there's a lot of potassium in foods. You can see here that apricots, a good sized serving there, has 1,162 milligrams. A cup of cooked white beans has 561. Leafy greens, a cup is about 558 milligrams. So an average sized banana, about 400 milligrams or so. You can see that you can get, if you eat lots of good legumes and vegetables, you can get quite a bit of potassium. but it's still surprisingly difficult to get that much. One thing that limits potassium in supplements is the government limits how much we can put into a supplement. And that's because accidental overdose, and it would be much more than the 4,700 milligrams, but it can be hazardous if you get huge amounts. And so they worry that a kid might get into chewing a lot and swallowing a lot of tablets or something like that and might run into problems. So they limit the dose in a supplement. You can get higher dose ones as drugs, but in supplements they're limited to have to be under 100 milligrams per dosage. So, you know, that gets into a lot of tablets or capsules if you're wanting to get a very big part of your requirements. Another way you can get it, though, is from V8 juice, the low sodium V8 juice, actually. And this is where I get sort of boost some of mine along with the potassium capsules. This has, look back here, 1,250 milligrams or 25% of your daily requirement of potassium in one can. Now that's a lot of potassium, and it's a pretty healthy way of getting it. Now the regular V8 juice doesn't have quite that much. The reason that it's in the low sodium V8 juice is because they put potassium chloride, which sort of works kind of like sodium chloride salt. It doesn't, not quite the same, but it helps with the flavor. And that's why it's really there, not to give you potassium necessarily as a supplement. But it's not a bad way of getting some, and it's one of the ways that I use, in addition to supplements, and in addition to I eat a lot of these foods that are on the list because I'm a vegetarian. So I like to eat a lot of legumes, a lot of vegetables and fruits, and those are all great sources. So there's a lot of ways you can get potassium in your diet if you pay attention, and that's one of the best things you can do for reducing your risk of getting leg cramps, is to get those potassium levels up to a good range. And if you go to a doctor regularly, you might want to be tested for potassium levels to see how you're doing, because it is very important for leg cramps. It's also important for a lot of things. Potassium is a really important mineral. Now, like I said before, the calcium and magnesium, the research is kind of up in the air for those, for leg cramps. They do a lot of great things in your body. Magnesium has a lot of popular support for people who believe it's helpful for leg cramps. And it does tend to be a muscle relaxer, magnesium does. However, the research, and specifically on leg cramps, is not yet convincing. It's been difficult, but like I say, it's a hard thing to research. So it's important for muscles, but the research for cramps has been equivocal. It's a very wonderful mineral for your heart and for a lot of things. So it's something you certainly want to get enough of. It's very important for blood pressure management. Likewise, calcium, just like magnesium, has a lot of anecdotal support for cramps. We know it's important for muscle action. It's very important for that. Nevertheless, when studying calcium supplements for leg cramps, they've never been able to quite make up their mind if it's working well or not. So there again, we have kind of equivocal research. Most people recommend getting plenty of calcium and magnesium to prevent leg cramps anyway, just because it's certainly something you need to do, and most people believe it probably does help. Generally 500 to 800 milligrams of calcium as a supplement is plenty. Calcium is one of these minerals that you get in a lot of different foods. So, most people, they recommend get about 1,200 milligrams of calcium per day, but you're going to get part of that in food, so you don't have to get the 1,200 from supplements. And I don't recommend people do. If you eat a really good diet, 500 milligrams of supplemental calcium is actually pretty good. If you have a lousy diet, 800, okay? But calcium and magnesium are both really very valuable minerals, and I recommend if you have muscle cramps, to use those too. You know, one of the really things that surprised me in reading up on this was the actually pretty good research for quinine for treating and preventing muscle cramps. Very good research, and I'll show you several papers here. This one talks about it from Frontiers in Pharmacology. Here we have one, treatment of nocturnal leg cramps by primary care patients over the age of 60. Talks about using quinine. So does this paper. In fact, well, no, this one talks about using potassium. So I've got 3 papers here on quinine. I had one sort of mixed up in here. This one from I don't even know that journal. One of the Springer journals also talks about using quinine for muscle cramps. Now, you've got to be careful with quinine. It's one that is a drug, and it is one that does have side effects if you take too much of it. They recommend in one of these journals about 200 milligrams a day of quinine is what they use in their study. I don't really suggest you try it that much. That's a pretty good dose of quinine. And I don't think for you to, if you can get the quinine, I wouldn't go quite that high. One thing you can do if you're having leg cramps, tonic water that you can buy in the store has quinine in it. That's what makes it bitter. So you probably heard of gin and tonic. I've never had it myself, but I don't know if it's good or not. The quinine water actually is pretty bitter, but it doesn't taste too bad to me. And what makes it bitter is the quinine. Most of these bottles like this, a whole bottle would have about 80 milligrams in it. And this is something you can buy for under $1 at Walmart or whatever. So you can get some quinine. I would suggest maybe half of that bottle, so about probably 40 milligrams. Some of the bottles will tell you how much quinine are in it, and some won't. But most of them have around 80 to a bottle like that. And drinking 1 or 2 bottles a week during the week, a little bit of quinine may be helpful. It's one of those things that I tried when I was having some cramps, and I thought maybe it helped. But there again, I can go for months without having cramps, so I wasn't quite sure. So I won't tell you that it worked for me. I can tell you that I didn't have cramps while I was doing it, but then I might not have anyway. So it certainly didn't hurt. And actually, I sort of enjoyed it. The one thing you do have to worry about there is the sweeteners they use, and they use a little bit of sweeteners. Not a lot, actually. It's not that sweet, but they do put some to kind of offset that bitter quinine taste a little bit. So look for one without much sweetener if you can, and you'll be a little bit better off. But like I say, the research is pretty good. It's actually a natural herbal extract from the cinchona tree, and this says on it that it uses the natural quinine. So that's pretty commonly available. The bark extracts have been used to treat malaria from what they say at least since 1632. It's been around a long time. It's a very important medicine. One sort of interesting note here, the wholesale price in the developing world is about $1.70 to maybe a little over $3 per course of treatment. In the United States, the course of treatment is more like $200. So, we keep getting the bad end of these drug deals and payments. But anyway, if you want to try that, it's something that you can find easily. You can find that tonic water anywhere just about, and give it a try. It's a nice herbal extract. And that's all for today. So just to review briefly what we'd like to do when we're getting these leg cramps, first of all, just deal with it right there as best you can. Stretch that leg out put your toes way out in front. Uh, I like to just sort of grab my muscles like that and shake them up and, and get them going again. And usually that helps. And like I say, regardless, it'll go away in a minute or two or three. Anyway, but then you want to not get them again. And I think the biggest things that you can do are, one, potassium, and two, water. Make sure you get plenty of each. And secondarily, take your calcium and magnesium. Take something like our calcium, magnesium, and D, the coral calcium. It's a pretty good source of it. And that will keep that up. It may not make the cramps go away, but it might. But it'll do a lot of good for you anyhow. And then take some of the potassium capsules, drink a V8 juice once a day, eat a lot of good fruits and vegetables. You should be great on potassium pretty easily. And so we really want to do what we can. We don't want to quit exercising. That's really important for our health, and we want to keep that up. But we don't want the leg cramps. So I hope you've learned a little bit today. I hope this is going to help you if you have that problem. And for now, have a great rest of your month. Have a great new year 2020. Hope it'll be wonderful for you. And thank you very much.